Very much. Good afternoon, everybody. Michael Mann from Health Markets. Show of hands, how many people have an agent? Yeah, it's pretty funny, huh? I can't see anybody. If you don't have an agent, you definitely need to have one this year coming up. There are a lot of changes going on. If it's me or if it's someone that you know, family relatives, I don't care who you have, but you need to have somebody make sure they look at your Medicare plan, because there's so many changes. And if you don't have someone looking every single year, because there's no charge to it, so why wouldn't you want to do it? You're going to be cheating yourself on benefits. Lots of the hospitals are changing now, meaning sometimes you're going to see that some hospital systems are not going to be part of a Medicare plan or Medicare Advantage plan. So that's why I want to make sure if you learn anything today, talk to somebody to go over your Medicare plan. If you have one, if you don't have one yet, you're going to be turning 65 soon, then you can find one. All right, so let's begin the presentation. Like she said, at the very end, we'll do questions as they come up, because I know Medicare is very, very confusing. And that's why I really decided to start and left corporate America to help people, because I found it's very rewarding. And we don't charge anything for any consumers, so that's why it's even more rewarding. I'm Michael Mann, licensed insurance agent. I work with United Healthcare, Aetna, Humana, Blue Cross Blue Shield, Devoted Health, Cigna, Mutual of Omaha, Transamerica. I work with, our company has a couple hundred different carriers we can use, but the main ones are Medicare are these right here. I'm also licensed in 18 states. So feel free, if anybody's going to need help in other states, can do that as well. And as far as community, I am the trustee for the Village of Deer Park. Barrington Career Center, I teach LinkedIn classes. So if you're looking for a job, Barrington's really got a great career center, and they do go virtual. Spirit and Crohn's and Colitis Foundation. So key terms. Beneficiary, we hear that a lot. Individual who's covered under Medicare, that's you, okay? Premium, fixed amount you pay for coverage, usually monthly. Deductible, that's a preset fixed amount you pay before the insurance starts. So before you start getting those discounts get kicked in, you first have to pay that deductible first. Copayment or copay is a fixed amount you pay for each service or product. You're going to go see your specialist, $30. You're going to go and get x-ray, $100. That's a copayment. Co-insurance, amount, usually percentage you pay for share for services after you pay your deductible. So you want to see your specialist, it's going to be 30%. Each plan has different co-insurance. Some don't even have co-insurance. They'll just have co-payments, but each one's treated differently. So that's why you might see those terms. What is Medicare? Everybody, we always see those TV commercials, that red, white, and blue card, okay? You're going to be turning 65, or you are 65 already. If you're turning 65, if you know any relatives or friends, I always tell them 3 months before you turn 65 is when the whole process begins. And what you want to do is you make sure you can go to the Social Security office. I always recommend going there. You can go online, medicare.gov. But if you do go online, it seems to go quicker. And then you got plenty of time, because 3 months, it doesn't start to the first of that month. So if your birthday is in April 17th, your insurance is going to start on April 1st. 3 months prior, March, February, January. January is when you're going to go to the Social Security office, and that's when you're going to sign up for your Medicare's Part A and B, which we'll talk about soon. Medicare's federal health insurance program began in 1965, provides health insurance for people who are 65 and older, who are under 65 with certain disabilities, who have end-stage renal disease, or other chronic conditions. And you can have your Medicare after 65. So someone on this channel right now might be 68 years old, still working. Keep your company's corporate insurance, that's great. Once you know you're going to retire and start using Medicare, that's when you're going to call that Social Security office or go over there and get your A and Bs we're going to talk about. So it has 4 parts. Part A, so you're going to see in your Medicare card, you can see your name, you're going to see some letters, numbers, letters, numbers, letters, numbers, and then you're going to see Part A, a date, and Part B, a date. The A date's usually when you turn 65, and the Part B date is when you're going to actually start using your Medicare. So A is for hospitals, skilled nursing, home health care, hospice. So the people that Elderwerks deals with mostly, they're using Part A. B, doctors, preventative diagnostics, DME. DME, if we look at the bottom part here, is durable medical equipment, hospital beds, wheelchairs. And then you have C, Medicare Advantage plan. And you have D, prescription drug plan. Those are the 4 letters. You're thinking, oh, there's Medigap or supplements. That's like, sometimes they call it a Part E, but really it isn't, but that's what they call it. And just so you know, you got A, B, and D all combined makes that Medicare Advantage plan, which we're going to talk about. So the original Medicare, so you can have just Parts A and B Medicare and even a prescription drug plan without a Medicare Advantage or supplement plan. Highly don't recommend that. We'll go into why not in a little bit. Qualifying for Parts A, work 40 quarters, 40 pay periods, or 10 years. That's how you're eligible to get Medicare. Even if you come from outside this country and you've worked for that 10 years, you qualify. You find Part A, deductible days 1 through 60 are covered for the hospital. And then skilled nursing up to 100 days are covered. Eligibility qualify under spouses. So your spouse worked for that number period of time and you were the home giver and helping people in the family. And then buy-in. So you can technically have Medicare without ever working here. It just costs money and it's pretty expensive. The hospital deductible we talked about before, it's days 1 through 60 are covered, 60, 1 through 90 per day co-insurance. So in some Medicare Advantage plans, you're going to start seeing that it might be $0 in the beginning for the first 20 days, and then afterwards you have a co-insurance. And then days 91 per each lifetime reserve, day after day, $90 per benefit period. So that just means you're going to be paying yourself for that. Skilled nursing up to 100 days of coverage, days 1 through 20, and 21 through 100 is covered with your Medicare Advantage or can be with supplements. All right, let's learn about Part B, premiums based on income. So this year, for 2025, we are paying $185 a month for your Medicare Part B. The majority of America is paying that. Now, if you are making over a certain dollar amount, there's something called IRMA. If you're paying IRMA, you're going to get another letter from the Social Security saying you are making over $200,000, $300,000, whatever that dollar amount is, $150,000 a year. This is after you retire, but it's all your investments. They will charge you the $185 plus an additional $75, $100, $200, whatever that IRMA would equal based on how high of an income you have. And that covers the medical necessary services and preventative services. So remember, B was the doctors, A hospital, B doctors. Out-of-pocket cost, annual deductible, covers 80% of the cost. Beneficiaries pay 20%. Remember, beneficiaries is you. So if you just had an original Medicare, $100,000 hospital bill, $80,000 the government pays, $20,000 you will pay. That's why you'd rather have a plan that's could at least have an out-of-pocket and it stops. 15% excess charge if provider doesn't accept Medicare assigned rates. So if you go out of network, and that's what you need to worry about. What don't Part A and B cover? Joan learns that Medicare won't cover everything. Remember, A and B is that red, white, and blue card. That's original Medicare. So acupuncture, chiropractic services, nursing home, long-term care. Remember, you're in the hospital, and then you go away from the hospital to a nursing facility. Original Medicare is not going to cover that. Dental care and dentures. Hearing aids. Routine vision and glasses, except for cataracts. Cataracts will be covered under Part B. So if you have original Medicare or any kind of Medicare at all, cataracts are covered. Emergency medical care. And then prescription drugs. Remember, D stands for drugs, Part D. So that's why it's not covered under A and B. Medicare Part D, prescription drug plans or PDPs are offered by private insurance companies. Aetna, Humana, Blue Cross Blue Shield, United Healthcare. You need to be enrolled in Part A and or B to qualify. And there's a penalty for late enrollment. Highly, highly recommend if you're going to be joining Medicare Supplement plan or Medigap plan or just the original Medicare, you still should sign up for a PDP plan. People don't want to do that because some of them might cost some money per month, and you're thinking, you know what, or I'm totally healthy. Why do I want to spend $12 a month? I'm totally healthy. You're right. You're fine. Except I've had people in their 80s who've waited 15 or 20 years to not have a prescription drug plan. Now they've got some really hefty insurance expenses for their prescriptions. It's roughly 40 cents a month penalty if you don't have a prescription drug plan. 40 times 12 is $4.80. So let's just say $5 a year. 10 years, that's $50 they're going to give you. They have to do a penalty in addition to your prescription drug plan. So you don't want to get stuck with the $17 or $20 plus $50 every single month when they only cost $17. So if Medicare Advantage plan, don't need to worry about this, but if you have a Medigap, supplement plan, the same thing, or original Medicare, you still need to get the prescription drug plan. Additional Part D information: may purchase a standalone plan or may be included with Medicare Advantage plan. A deductible usually applies. This year or next year, it's going to be $615. I think this year it's $585. Not all plans that are prescription drug plans do have a deductible, though, or they have a less amount. A drug list or formularies based on tiers. So tiers, there's 5 tiers, really 6, but mostly 5 tiers. So those generic drugs, tier 1 and tier 2, those usually don't get the deductibles. So you might be paying $0 to $5 for tier 1 and $5 to $10 for tier 2. It's those drugs you see on TV commercials. Those are the expensive ones. Those are the 3, 4, and 5s. So that's how the tiers work. And your agent should definitely be able to help you because they're going to put all this information into the computer and tell you how much your prescriptions are going to end up being every month, every year. And premiums can vary based on income. So what happens is that IRMA still kicks in for this as well. All Part D plans have the same structure. So there's a deductible. So let's say your deductible is $400. In January, you might have $600 worth of drugs, and you're going to have to pay that first $400. Once that first $400 is covered, then the $200 left over, that's when they start doing the co-insurances. Initial coverage phase is when you get that discount. And catastrophic phase, that would be $2,000. Okay, so let's go back. 0 to whatever the deductible is. Then there's initial coverage, that's the discount, and at $2,000 we stop for year 2025. For year 2026, we're going to be up to $2,100. And some people are saying that's so much. If we were in year 2024 and earlier, they used to have something called a donut hole. We'll go through that another day. But it went up to $8,000 for prescriptions. Now we're down to $2,000, which is great. Also, if you find that it's too expensive for you to get that first month because that's deductible, the insurance carriers can do like a level billing, I call it, like for heating. So if you have like a $700 bill the first month, but then it keeps on tapering down, and then by December you pay nothing, they can make it like $100 a month, whatever you want it to be. They can level the billing the entire year so you don't get this big hefty bill come January. Medicare Part D, plan structure, deductible phase, we just talked about. Part D, copay, plan pays balance, and then, like I said, after catastrophic, that's the $2,000 this year. Next year, it's $2,100. And what this green and orange means, that's just what you're paying and what Aetna or Humana or United Healthcare, whoever they're paying. All right, then now there's Medicare supplement plans. So if you remember, there's 80-20. If you just have original Medicare, 80% the government pays, you pay 20. Now we have Medicare supplement plan. We're not talking Medicare Advantage, totally different. Medicare supplement plan. This covers that 20%. So whatever the government doesn't cover, this covers. It's also called Medigap because people they call it both ways. It's sold by private insurance companies. You see lots of TV commercials, AARP. They're probably the most in this area as far as commercials go, Blue Cross Blue Shield. Works with original Medicare. It covers the gaps. So if you go to the hospital, $80,000 the government pays, United Healthcare is paying the $20,000. It does not include Part D prescriptions and cannot have if joining a Part C. Part C is Medicare Advantage. So you're not allowed to have a Medicare Advantage plan and a supplement plan. So the way I tell people to think about it is if you have, let's just say $200 a month is your premium, because with Medicare supplement plan, you're paying a premium every single month to have this. Healthy, you go to the doctor once a year, still $200 a month. You go to the hospital 5 times a year, $200 a month. So it makes no difference how many times you go, but I always try to say it's $200 times 12 is $2,400. That's what you're paying for the entire year. You leave your wallet in your pocket. You don't pay for anything else except for a deductible. This year, the Part D, B deductible is $185. Next year, it's $206. So that's the big difference. You pay a deductible, but then you leave your wallet in your pocket. Primary doctor, specialist, physical therapy, hospital. You don't pay anything. So it's nice and clean. It doesn't offer what we saw before, dental, vision, hearing, all the other things, but it just covers the gap. And it's so $200 times 12 is $2,400, but it does go up every single year. So you might find that when you're 75, it might be $300 a month times 12 is $3,600. And then when you're 85, it might be $400. So you're getting close to $5,000 plus your prescription drug plan. Might be paying $6,000 at the end. Versus the Medicare Advantage plan might have an out-of-pocket of $5,000 or $4,000. So that's when people start maybe thinking about Medicare Advantage plans for sure, if they don't start already with it. And you can, with Medicare Supplement Plan, sign up for it when you turn 65 right away. There's no underwriting. Let me say that again. You could be on hospice, have cancer, had 5 heart attacks, no matter what. When you turn 65 and you want to sign up for a plan, and you know you're going to have lots of hospital bills and stuff like that, you can have a Medicare supplement plan. They cannot turn you down. If you want to start with Medicare Advantage plan because you like that $0 premium, but you know something's going on medically, and a year or two down the road you want to sign up for a supplement plan, they're going to pull your medical records. They're going to get your prescriptions, your doctor's visits, whatever else, been in the hospital. They can turn you down for Medicare supplement plan, but not when you first start. So I always tell people that's another good thing. If you like the idea of, I know no one wants to pay money up front always, but if you like the security of knowing you have a fixed amount, you're going to pay any more, and you can afford it. I mean, there is a budget needed, so make sure you keep that budget in mind because we want to make sure you got food on the table before we worry about the medical expenses. Medicare supplement plans. Very confusing. You see all those letters. You can do all those types of Medicare supplement plans. Remember, this is the Medigap, the one that covers that 20% that the government doesn't cover. I personally would do like 95% Part G. They pay everything except for the deductible. And the deductible is going to be $206 next year. It's $185 this year. Some people like the N. That's the only other one I do because it's pretty much mirrors the Medicare G. But the problem is that you will be paying the $20 copay for doctors. There's this, if you look in the bottom here, it's just some little nickel and diamonds. So why not do the clean thing and do a G? And for those people that are older listening right now, there is something called an F, but that's been stopped. It's grandfathered. So if you're a certain age, you can get it. And that was everything, including the deductible. So that premium is the highest of all the highs. Then G's the next highest, then N, and then they keep on going down based on what they cover. But I only do G's. If someone really requests an N, I do whatever they want. I just tell them the big difference is they look at the checkbook and like, the G's probably the wiser move. All right, so now what is a Part C? That's the Medicare Advantage plan. That's the A, the B, and the D. They're all combined, okay? Includes Parts A and B. Some plans include a Part D, known as MAPD. This is where it gets a little bit confusing because you see MA over here, how to qualify for MA plans, and you see MAPD. And people in my office, they get confused by this too. And it is confusing. When they're talking about some plans include, most of the plans out there include a prescription drug plan. Very few of the carriers, they only have one or two plans that are MAs. And most people that get those are like the vets. I work with a lot of vets. And the vets go to the VA and get their prescription drugs there. So if they go to the VA to get their prescription drugs, a lot less expensive, then their plans are more, the word I'm trying to think of, they might have, instead of dental being $2,000 for a Medicare Advantage plan, it might be $3,000. For over-the-counter benefits, it might be, instead of $50 a quarter, it might be $100 a quarter. It's just, they give more benefits because they don't have to worry about the prescription drug part. So that's, but you run, if you don't have a VA or anybody with prescription drug plans, don't just do the MAs because of the benefits, because you need those prescription drugs, and you can't have a Part C and D both. You can only have the Part C or a Part D. So MAs are just good for those people with prescription, with like the vets, or somebody who never signed up for the Part D, and now they don't want to pay that penalty. Now they'll do the Medicare Advantage plan only without prescription drugs. Many additional benefits. We talked about vision, hearing, dental, over-the-counter benefits. Over-the-counter benefits, what's that? So if I'm at a CVS and I put my back at the pharmacist, I'm looking out at the Tylenol, Aleve, ibuprofen, cough medicine, Depends, dental, vitamins, supplements. Those are all products, and some of these plans have over-the-counters, $30, whatever. They give you different dollar amounts per quarter. You can either go to that store and pick it out, or they'll send it to your house. And they're offered by private insurance companies. So you have to be enrolled in Part A and B. You have to have Part A and B, no matter what, just like for supplement plans. If you don't have B, you don't want to pay that $185 a month, well, you're not going to get this insurance either. You need to have both. Live in the plan service area. That's, I mentioned, your county and zip code. So if you know you're going to be moving to a different county and zip code, make sure you tell your agent, because he needs or she needs to look to make sure what plans are available to you there. Because just because you have a plan here, plan gold plan, whatever it is you want, it might not be where you're moving to. And even if it is, it might still be a little bit different. So you have to get it changed. Medicare Supplement versus Medicare Advantage. If you join a Medicare Advantage plan, you don't need and can't purchase a Medicare Supplement plan. Remember, you can't have a Medicare Advantage plan and a supplement. Cost, pay Part B, you have to do that for both. Supplement plan or Medigap, you pay a monthly premium. Medicare Advantage plans, you pay $0. Little to no copay depending on plan selected, copays and coinsurance, plan as used. So remember, supplement plan, leave your wallet in your pocket, except for that first deductible. If you do the G, it's done for the rest of the year. Versus Co-pays, co-insurance. Yeah, you're paying $0 a month. And yeah, I'm going to go to the specialist. I'm going to get an x-ray. That's it. Any provider accepting Medicare for both may be required to use a provider network. So we got HMO and PPO plans. HMO, so you stay in your network. PPO, you can go in and out of network, versus a provider choice Medicare. You can go anywhere you want. Mayo Clinic, Florida, Arizona, Minnesota. Pretty much, if you have a concierge doctor, then they won't probably take Medicare because they don't take any insurance. If you don't know what a concierge doctor is, you don't even need to worry about any of this stuff. Enrollment, you can apply to buy a Medigap plan at any time after you turn 65 and join Part B. There's specific enrollment periods during the year. You can enroll or switch different Medicare Advantage plans. So the reason why I always help people with Elderwerks this time of year is because October 15th through December 7th is the Medicare Advantage annual enrollment period, AEP. This is when you can pick any new plan you want, change a plan. This is when you should be talking to your broker and say, hey, what's going on? I want to know what plans are out there for this year. Has my plan changed? I already know there's some hospital systems that locally here, they're not going to be taking certain Medicare plans. That's why you can only do it during the annual enrollment period. There is a period January 1st through March 31st for Medicare Advantage. That's the open enrollment. If you're really not happy with the plan you got, you can then move to a different plan. Other than that, you need to have a reason to move. Drug coverage, none for Medicare supplement plans. You need that separate PDP plan we talked about, but they are included with Medicare Advantage plans unless you have that MA plan that vets using, then you'd have that. There are programs to help with Medicare expenses. If you have Medicaid, if you have Medicaid and you're on this call, you 100% should be talking to an agent or somebody this year. There's something called a dual plan. It's called dual special need plan. Never has been available in the state of Illinois before. This is the first year. I'm in 18 states. I'm using them in all the other states. If I work with Medicaid people and Medicare, you put them together, that's a dual plan. It's a DSNP. That's the first time ever in Illinois that they have this available. It's very, I mean, this will give you money for food every month if you have a chronic condition, certain kind of conditions. Gives you money for transportation. It's a lot more richer in benefits. So if you just have a plan now and you have Medicaid, talk to the person, because I'm telling you, you're going to be very, very happy. So if you're on Medicaid, how do you, just for those that sometimes get confused, Medicaid is for financial reasons. They have a certain income. You have to report to the government when you do your taxes. And then if you are below that income, that's how you qualify for Medicaid. Helps pay costs for your covered Medicare, provides some benefits not covered under original Medicare. There's Medicare savings plans, help pay for Medicare Parts A and B, premiums, other cost sharing like deductibles. And then the one that's used a lot too is called extra help or low income subsidy. So let's say you're making more than $13,000, whatever that Medicaid level is this year. You're only making $21,000 as a couple, or $32,000. There's something called extra help or low income subsidy. Your agent should help you with that as well. This will help your prescription drug plans be less expensive. So remember, we have tier 1, tier 2, tier 3, and maybe that tier 3 drug is usually $50. If you have LIS, low income subsidy, it might be $7. So this is a discount on prescriptions. Medicaid is driven by the state, so it's state to pick your Medicaid that help you. Low income subsidy or extra help is driven by federal government. So it's two different entities working here. Helps pay for Part D prescriptions, premium deductibles, co-insurance, co-pays, and caps. One thing also I want to mention too, when it comes to here about the differences, I hear a lot of people talk about, I don't trust Medicare Advantage plans. I hear so many bad things. I always want to know who the person is saying bad things about it. I sell both. I just want you to be happy. Choose what you want. That's all I care about. But sometimes people have a bad taste about Medicare Advantage because they said something, they heard it from somebody else. Remember, you can do HMO. That's when you go to your provider and they find a doctor for you. PPO, you want to go to your primary doctor, but your next door neighbor's an orthopedic surgeon and he's not part of that network, but you still want to use that person. You can do it. The government gives a certain dollar amount every single month So they don't have to do that 80-20. Remember, Medicare supplement, 80% the government pays, 20% your supplement plan pays, and you pay that premium. So if you get a Medicare Advantage plan, no longer does the government have to pay 80% of any of your doctor bills. Okay? So with that in mind, now Medicare Advantage gets a certain dollar amount every single month. And because of that, you see those TV commercials. I get money back on my Social Security. I get this dental, I get over the counter, I get hearing, whatever. Yes, they do, because there's such a high dollar amount involved that they think it's much better, the insurance companies, to sort of entice you to come to them by offering these things and using your actuary saying, you know what, most people only have $3,000 the most per year on medical expenses on average. And if the government gives a certain dollar amount a lot higher, we can use that for dental and for payments and stuff like that. So that's why nothing is free. The government helps us giving money to the Medicare Advantage plans. And that's why it's not a gimmick. People used to think it's a gimmick. So how can I get Medicare coverage? I'm turning 65 or about to. Remember, 3 months before your 65th birthday. So when I want you to go to the Social Security office and sign up for your A and B, or when you know you're leaving your job, and you're 67, 72, whatever that might be, you moved outside your planned service area. Remember, zip code and county. You move to same part of your town, don't worry about it, as long as it's the same zip code and county. But if you're moving to a different zip code and county, talk to your person you work with. Move back to the United States, moved into or out of long-term care facility. You have traditional Medicare, but you want a supplement plan, just released from jail, or lost coverage from an employer. And that comes back to when I'm saying you're 68 years old and you left. And there's the enrollment periods we talked about. If you have any questions, I mean, you see my name's down there, my email address. You can always go to medicare.gov or Social Security office and call them up as well. And there's numbers there. You just Google, go on medicare.gov or Social Security office. And that is Medicare Advantage in 40 minutes.